A heart beats about 2.5 billion times over the average lifetime, pushing blood to every part of the body. The steady flow carries oxygen, giving the heart a never-ending workload, but it requires care to prevent cardiovascular diseases. Maintaining a healthy lifestyle, even at a young age, goes a long way to keep your heart healthy. Our special Heartline starts right now. Since 1963, February has been designated as American Heart Month, raising awareness about heart disease. It's a time for all people to focus on their cardiovascular health. Maintaining a good diet, consistent exercise, and quitting smoking can greatly reduce heart risks before they cause damage. But sometimes expert medical care is required, and the cardiovascular specialists at Penn State Health St. Joseph Medical Center are committed to preventing heart and vascular disease and finding better treatments for you. Good evening. I'm Liz Kepner. Penn State Health St. Joseph Medical Center utilizes the latest approaches to find, treat, and rehabilitate your heart and vascular needs. Tonight, we'll look at the latest treatments and surgical procedures in heart health. And we'll visit our kitchen right here in our studio to talk nutrition and heart disease prevention. For now, let's send things over to Christina, who is in our kitchen right now. Hi, Christina.
Hi, Liz, and that's right, we are in the kitchen, and that's because throughout tonight's show, a dietitian will be joining us to offer us some heart-healthy tips and tricks in the kitchen. But right now, we want to introduce you to our first patient of the evening. She was in active heart failure, but did not know it until it was picked up by routine blood work. Here's her story.
I was dying. I was at death's door. Anytime my heart was going to go. The transplant was an absolute miracle. I could do everything that I could do before. I'm a whole person again. Hershey Medical Center was absolutely, positively amazing. I just can't get over the amount of support that I had. It just feels like a miracle. I had multiple heart attacks before the one that was found. I worked in an operating room, and I was also going to college full time. I was really stressed out, and I needed ankle surgery because my foot was hurting badly. And I went in on a Friday to have my pre-op check done, and I was on my lunch break, and I said, hurry up, I got to get back. I have another case. And they did that 1280 kg, and the nurse asked me how I was feeling, and I said, I feel fine. I said, hurry up, though, come on, I got to go. She walked out of the room, and she came back with doctors. And I was like, what are you doing? And they said, you're having a heart attack, Lois. And I said, I am not. 20 minutes later, I was on the table having a cardiac cath. It was like, bam.
We say about a third of heart attacks occur without the patient knowing. The nerves inside our body are very different than the nerves that go to your fingers and toes and other places in your body, and that was the case with Lois. So when she showed up, she already had a significantly damaged heart and was beginning to struggle with symptoms of heart failure.
Heart failure is a situation where, for a variety of reasons, the heart does not efficiently pump blood to the vital organs, the brain, the kidney, the intestines, et cetera, et cetera.
When they went in and looked here, I had so many heart attacks before that I already had cardiomyopathy. As time went by, I had treatments, I had medications. My heart started to get aggressively more bad. I couldn't walk, I couldn't comb my hair, I couldn't do anything. I was very, 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 very sick.
She had a very serious and indeed life-threatening heart problem, and she took it like a trooper. She would say, all right, what are we going to do next? She and I became a very good team for years in trying to navigate through her cardiomyopathy and congestive heart failure. And she did well for a while, but then she started to kind of decline a little bit. 6 months later, she really declined further. I don't think it took a long time before she was on the list.
When he realized that my cardiomyopathy was so aggressive, he got on the phone right away to Hershey Medical Center, and he got me an appointment the very next day, and thank God for that.
In cases like my friend Lois, we often need help from a university-level hospital. We can do probably 95% of cardiology that needs to be done right here in Berks County, but there often are cases that need a higher level of care, that is to say, a good university hospital, and we're blessed to have Hershey Medical Center, and there is a very good collaboration that we believe benefits the patients of Berks County very well.
When I knew that I was going to need a heart transplant, I did some research to see which hospital I wanted to go to. Hershey Medical Center has a really, really good survival rate. There's no infection rate, and I loved it here. This is where I felt safe.
The long-term survival after heart transplantation at Penn State Health, Hershey Medical Center, is amongst the best in the nation. Almost 600 heart transplants that have been done here. This year is the 40th anniversary, and we have been embracing every new advancement in surgical technique and immunosuppression to continue advancing the field.
You know, I'm sitting here with someone else's heart in my chest, and I wasn't overweight, didn't have high blood pressure, I did not have clogged arteries. The transplant was an absolute miracle. The journey afterwards, that's when they really, really are on it after your transplant.
The immunosuppressant medications have side effects. We have to watch for them, we have to monitor them, and we have to carefully manage that. We have a very sophisticated team and very rigid protocols that we follow in order to safely apply those therapies so patients do well. And in a matter of months, they transform from somebody who's a patient first and dealing with their medical condition as their primary thought to a person who is living life, and being a patient becomes a secondary thought, and that's where Lois is now.
It's almost like a rebirth. You have another chance. I could do everything that I could do before. I'm a whole person again with Hershey Medical Center. You are getting absolutely everything that you need. You don't have to go to a big city. You don't have to go drive all those places. You get everything you need right here.
You know, I think having a strong sense of empathy and being able to put yourself in their shoes and the fear that they're going through, it's a huge, huge driver for us, not just in the clinical realm where we take care of patients, but when we are doing research, when we are looking for the next generation of devices or drugs that prevent rejection. We take huge joy and pride in being able to get people back to their families.
My whole journey, I'm absolute most grateful for it, is probably Dr. Waxler. Dr. Waxler led me on the path to recovery. Every day is such a joy. You know, you wake up and you're like, oh, I woke up.
Amazing story, and Lois is currently doing wonderful thanks to the Penn State Health Heart and Vascular Pioneers of Heart Failure Care. Liz, back to you.
Just an incredible story. Thanks, Christina. We wanted to follow up on Lois's case. So joining us now is Dr. Andrew Waxler, cardiologist with Penn State Health Berks Cardiology. Dr. Waxler, thank you so much for joining us.
Well, thank you for inviting me. This is a pleasure.
So let's talk about Lois. You know, what a story, right? When you met her, what were you thinking?
So Lois didn't have the traditional standard heart attack. Most heart attacks are from blockages in the heart arteries. She really had no, or let's say minimal blockage in her heart arteries. But she kept having these areas of damage in her heart, and she turned out to have what we call a non-ischemic cardiomyopathy. What that means in English is weakness of the heart, a cardiomyopathy, an enlarged weak heart, but not from blockage. So we a lot of times you never know what causes that. I mean, we know certain things cause cardiomyopathy, but sometimes you don't find the answer. So it was one of these things where we weren't sure what the cause of it is, but there's kind of a standard approach of how you get somebody like that better. So she struck me, honestly, as a very sweet, very knowledgeable person. You know, what's the expression? We always get in trouble if you know just enough to be dangerous. So my wife's a nurse. I have a soft spot in my heart for nurses, and Lois is an OR nurse, now retired, locally. And so she and I kind of bonded right away.
That's right. Now, heart failure is a difficult diagnosis to make. What are the treatment options before you go the transplant route?
So heart failure itself is sort of a wastebasket term. It's a big term for a condition where the heart's not pumping properly to the kidneys, to the brain, to the other vital organs. There's sort of two types. There's diastolic heart failure, which means the heart's still strong. And patients have trouble with that. They say, if my heart's strong, how can I have heart failure? So it's a little bit of a difficult concept. But she had the more serious type, which we call systolic heart failure, which again, let me translate to our viewers, means an enlarged weak heart. So she had a cardiomyopathy, an enlarged weak heart with what we call systolic heart failure. It's a bad combination. And the answer to your question is, we recommend lifestyle changes like low salt diet. We recommend a standard regimen of medications. And it takes a little time to get the people on the medications. And so we had Lois on all the right meds, and most people do fine on the medicines.
It's just interesting because you look at Lois, she doesn't look like she, had things that she should be worrying about and everything. A big question people ask is, women have different symptoms than men when it comes to heart attacks, right?
That's true. Women tend to have unusual symptoms, but keep in mind that the majority of women still have the usual symptoms. So I always caution people that the usual symptom is tightness or heaviness or pressure. It's not pain. I've spent my entire career trying to get doctors to not ask patients about chest pain. It's pressure, tightness in the middle of the chest. Women can have more indigestion or jaw discomfort or back discomfort. Okay. So yes.
Dr. Waxler, you are going to be joining us a little bit later in the show, so stay right here. We're going to throw things back over to Christina.
Okay, thanks, Liz. We are back in the kitchen, and we are now joined by Mandel Smith, dietitian at Penn State Health, St. Joseph. Thank you for joining us and bringing this beautiful display. And we are talking tonight about heart disease treatment and prevention. Right. So can you tell us where these foods come in and how important a heart-healthy diet is?
Well, a heart-healthy diet, along with a healthy lifestyle, those are really key to keeping your heart healthy and just living a long, healthy life. We really encourage people to make sure that they're eating things like their fruits and vegetables and eating a low sodium diet. Those will really go a long way, along with lifestyle and medication, and to keep you healthy.
To keep you healthy. And we hate to ask it, but I think you have a good way of looking at this. Foods we have to avoid?
Mm-hmm. Yeah. I don't like to say that there are good and bad foods. All foods have a part in our diets, but we really have to be careful about things like saturated fat, butter and bacon. Right, they have a great taste, but it's not something that you want to eat every single day. You have to really find how you can fit those into your diet. There are other things that you can eat that are just as healthy and taste just as good.
Okay, the moderation there. Okay.
Moderation.
And you also recommend the DASH diet. Can you walk us through that?
DASH means dietary approaches to stop hypertension. And really the basis of the DASH diet, fruits and vegetables. Most people don't get enough fruits and vegetables. You want to add more fruits and vegetables to your diet. You want to make sure that you're eating a low sodium diet. And in addition to the fruits and vegetables, you want to eat things like dry beans. They're a great source of protein. Whole grains are really important too. And just looking for ways that you can cut sodium in your diet is really important. You can buy things that are no salt added. That's a great way to still get the flavor, but add the flavors that you want.
Okay.
Yeah.
All right. Thank you so much. We have more to talk about, including kids' lunches in a little bit. So we'll be right back with you. But for right now, we will send it back to you, Liz.
All right. Thank you, Christina. After the break, we'll meet a Superman with a super heart, a patient story from Penn State Health Children's Hospital. Stay with us. Welcome back to our Penn State Health St. Joseph Medical Center special Heartline. I'm Liz Kepner. Our next patient story begins at Penn State Health Children's Hospital. To kick it off, let's send things back over to Christina.
Hi again, Liz, and right now we are going to meet Superman, a little guy whose lifelong heart journey began at Penn State Health Children's Hospital, where they understand that treating and diagnosing heart conditions go hand in hand.
After his first open heart surgery, everybody just kept saying, "You got a super heart and you're Superman." Superman is strong and conquers whatever he wants to conquer. And so I think that's how we look at Kenny.
Everybody thinks I'm Superman.
The team here at Penn State Health was the right call for him. As soon as they started talking to us, I just knew there was just that comfort and that level of support that they had our trust. Kenny, when he was born, was diagnosed with hypoplastic left heart syndrome. He turned blue instantly. He started grunting for air. He just wasn't able to catch his breath. We didn't hear that initial cry that a baby usually does right when they're born. First they thought maybe his lungs, but then they realized it was his heart. I think my first impulse was, where's my baby? Didn't even get to hold him. Didn't get to care for him like I did with my first one.
Congenital heart disease affects approximately 1% of the population, so 1 out of every 100 children born will be born with some type of heart defect.
We think that it's a combination of a lot of different risk factors, things like environmental impact, maternal environment, or genetics. But the honest truth is that there is no single cause that is identified to date.
The symptoms that we usually see, that they seem to be breathing faster than they normally do, or they get more easily winded with exercise.
Most congenital heart defects are known about typically from a fetal ultrasound.
If it triggers a concern of heart disease, they will be referred to a pediatric cardiologist. We can cover our patients from the very beginning to as far into life as we need to. And the way that we do that begins with maternal fetal medicine and fetal cardiology.
The Congenital Heart Center at Penn State Health is really unique.
The veins came in over in here.
There are 3 core teams that make up the Congenital Heart Center, and that is the Pediatric Cardiology team, the Congenital Heart Surgery team, and the Adult Congenital Heart Disease team. The great thing for patients is that they smoothly transition between these teams to get the specialized care that they need.
We come together as a group. The cardiologists provide us with information that we need, and once we formulate a specific surgical plan, then we go ahead and execute it.
Once we learned that Kenny had hypoplastic left heart syndrome as his diagnosis, they went over more in details about what was going to be our new is what we called it. We learned that Kenny was going to be needing a series of 3 surgeries in order to help his heart function like a normal heart. We as a family felt like Penn State almost became our extended family because that's how much of a support system they became for us. Penn State Health was kind of in our backyard that allowed us that opportunity to find that team that we needed for support.
We are right in the middle of central Pennsylvania. Families can get care for their children in a place like home.
We are big enough that we offer all the specialties, but we're small enough and that we can provide very personalized care. The most rewarding part of my job has been the ability to take a child who has a very complex, sometimes fatal heart condition and repair it and meet that family and tell them that their kid's going to be all right.
Seeing blue babies become pink and seeing sick kids be happy and be able to do their daily activities.
We really want children to have normal lives. So wherever we can, we will try to either treat or fix the problem so that they can live a life like every other child.
He just wants to have fun and enjoy life as it is. And if that's playing golf right now, because that's what he absolutely loves to do, then we try to make that happen. And we take one day at a time.
Baseball, Phillies game, free ice cream, chocolate brownie, a golf place that I can hit golf balls.
We want him to enjoy doing what he wants to do.
We love to see Kenny doing so well, truly a Superman. And Liz, he's also a reminder of why families across the region have been choosing Penn State Health Children's Hospital for more than 30 years. Back to you.
All right, thank you, Christina. We're joined now by Marie Shaner, pediatric cardiology physician assistant with Penn State Health Children's Hospital. Marie, thank you so much for joining us. Kenny he's just so adorable. He is so cute. How common is congenital heart disease and how is it diagnosed?
Heart defects are the most common birth defect. Congenital heart disease affects about 1% of babies born in the United States. That equates to about 40,000 live births each year. The severity of the disease and the timing of diagnosis can affect outcome. But the good news is that with advancing diagnostic technologies and surgical techniques, babies born with congenital heart disease are living longer and healthier lives, just like we saw here today with Kenny.
And Marie, you're very involved with patients and their families. Tell us about, your role with the patients.
I'm a physician assistant in pediatric cardiology at Penn State Children's Hospital for 20 years. Early in my career, I was in the hospital setting, caring for babies and children with complex congenital heart disease in the ICU and in the critical care unit. But over time, my role has evolved to more of a community outreach model. We are very passionate about taking care of kids in the outpatient setting. Diagnosis of congenital heart disease, the severe types, is important in fetal or pre-birth. We use our maternal fetal medicine specialists and obstetricians and nurse midwives in the community, as they're our first line for detecting heart defects by ultrasound. In the pediatric cardiology office, we provide fetal echocardiogram or ultrasound. We also, after birth, will use heart rhythm monitoring or ultrasound. We also have more advanced testing.
Marie, if you suspect your child, might be having a heart issue, what are the signs and symptoms, and what can you look out for, and then find a specialist to talk to?
Yes, kids can present with symptoms worrisome for dangerous heart defects. Typically, kids will present with exercise intolerance or shortness of breath with play. Some other concerning symptoms would be exercise-induced chest pressure or palpitations, and certainly loss of consciousness with exercise would warrant pediatric cardiology evaluation.
Okay. And at Penn State Health Children's Hospital, you're passionate about making sure that you're bringing kids the best care to communities where you live, and that includes Berks County and beyond. Can you talk about that?
Yes, the pediatric cardiology team at Penn State Children's Hospital has been traveling across the state of Pennsylvania, providing outreach care for over 25 years. We have multiple pediatric cardiology subspecialty centers, including in York, Lancaster, Harrisburg, Hershey, State College, and Reading. Our office in Reading, serving the patients of Berks County, Lehigh, Schuylkill, and Bucks County, is at Penn State St. Joseph Hospital. I do believe that bringing our expertise and our experience from the Children's Hospital to the community is very important for providing compassionate care.
Marie, thank you so much for joining us. And now we're going to send things back to the kitchen, where Christina is there with Mandel for more great, interesting information. Guys?
Okay, hi again, Liz. And last segment we talked about the DASH diet, Mandel,
Yes.
but let's talk about the Mediterranean diet, and is that heart healthy?
It's a very heart-healthy diet, and when you think of the Mediterranean diet, you have to think about that wonderful part of the world where the Mediterranean Sea is, and that's where people are really eating a very healthy diet. One of the key things that's different with the Mediterranean diet is that we really focus on olive oil.
Okay, olive oil, good to remember there.
Yeah.
And it's good to hear that that's okay for you, that that's good in a heart-healthy diet.
Yeah, olive oil is a monounsaturated fat, very healthy for our hearts.
Okay, great. And we hear about meal planning a lot.
Yeah.
Can you, I know we all make that face. We know it's good, but we don't do it. But can you talk to us about why it is important and how it helps to keep us on track?
Yeah, meal planning is really key because if you plan those meals ahead, if you take a little bit of time, like maybe on the weekend, to kind of think through, make an outline of what you're going to serve that week when you're driving home and you're busy, and you can just drive right past those fast food restaurants because you know that you have something healthy that you're going to cook when you get home.
Okay, and speaking of meals that we prepare, a lot of us are doing kids' lunches. What can we do to make those healthier than throwing in a bag of chips or snacks?
Well, I always remind parents that you can make your own chips with veggies.
Yes.
We've got carrot and cucumber chips here. You can add a little bit of hummus with this, maybe some light ranch dip. Kids love that. And get the kids in the kitchen with you when you're preparing those lunches so they can help and learn what's healthy.
And good family time too with that.
Yeah,
And
exactly.
speaking of family time, can you share with us some quick and healthy recipes you might be able to make for your family?
Well, I always say think of those favorite recipes that your family already loves, and think of ways that you can make those healthier. If your family loves spaghetti, use whole wheat pasta and maybe put some squash in it, some tomatoes, some kale, anything that will brighten it up and just add more vegetables to it. So we don't get enough vegetables, so that's really important.
Veggie it up. Okay.
Yeah.
All right, Mandel, thank you for all of your time tonight and your insight.
You're welcome.
Liz, back to you.
I'm hungry now. Thanks, Christina. Back with us now is Dr. Waxler, cardiologist with Penn State Health, Berks Cardiology. Dr. Waxler, February is Heart Month. Let's talk about heart disease prevention. What are 3 things that you can do right now to prevent heart disease?
Well, first of all, when you talk about heart disease, the number one killer for all of us, our number one threat to all of us adults is coronary artery disease, hardening of the arteries of the heart. That's sort of, with all due respect to my friend Lois, that was not her problem, but that is the number one thing we're most afraid of. The number one thing to do is throw the cigarettes in the garbage. It really does make a huge difference. Patients say to me, I've been smoking all my life, does it really matter? It does matter. So it's never too late. Number 2, walk or do some type of exercise. If you've been a couch potato, talk to your doctor before don't go. Don't do what we men try to do, which is go from the sofa to running the Boston Marathon. Not a good idea. Right. So, start slow, start low, go slow. And number 3, work on your diet. The diet tips tonight are outstanding. I try my best to eat a Mediterranean diet. I think it's the best. It's hard. But remember one thing out there for the diet is if it's white, do not bite. Low carb. You got to cut back carbs with the Mediterranean diet.
Right. Well, let's talk about yearly physicals and knowing your numbers when it comes to like cholesterol or blood pressure.
So what you have to realize is coronary artery disease, again, the most important heart disease that we have to really worry about, all of us, me included, is a silent disease that starts in our 20s and sometimes even our teens. There were some very frightening studies from the 60s and 70s that show that this stuff starts early and it's silent, silent, silent. And it's increased, it's magnified by other things that are silent, Liz. So you've got high blood pressure, high cholesterol, diabetes. Those are all 3 silent killers. And people don't have symptoms, but they're having damage done to their arteries. So the main reason to see a primary care doctor every 6 to 12 months is to look for silent things that you're not going to know you have until there's damage.
All right.
Prevention. And if I may say one more thing, Liz.
Yes.
One of my role models likes to say, it's much better to turn off the faucet rather than mop up the floor afterwards.
Okay. Now, let's talk about the cardiac calcium tests.
Yes, ma'am.
That's something that people are talking about. Who should have one?
So a coronary calcium test is a non-invasive, like 30 to 60 second quick CAT scan of your heart with minimal radiation, no X-ray dye. They don't put an IV in. It's very, very safe, minimal radiation. Anybody that is concerned that they may have early hardening of the artery blockage, that they don't have symptoms. For instance, somebody like myself, I'm in my 50s. For me, it may be helpful to know if I have early blockage because it may change what I do. For instance, it helps people to be more aggressive, lowering their cholesterol. Once you tell a patient, sir or ma'am, you have early blockage, all of a sudden they get much more aggressive.
Okay. All right. Thank you, Dr. Waxler. As always, that's going to wrap things up. You deserve your own show. You can find the latest information on our website, pennstatehealth.org/Berks-Heart. We also want to remind you that if you're experiencing symptoms that require medical care, please don't wait. Reach out to one of our experts now to get an appointment scheduled, because at Penn State Health, St. Joseph Medical Center, your heart is always in good hands. Good night.